Today I would like to speak to you about the tissue reaction to certain retrograde filling materials employed in endodontic practice. This was an experimental study. In modern dentistry, the basic philosophy is conservation, preservation and restoration of the dental arches. Maintaining this integrity of the natural dentition is an essential prerequisite. Endodontic therapy has played an important role in achieving this goal by enabling the teeth to be conserved and retained without constituting a danger either to the health of the supporting structures or to the general health of the patient. Periapical surgery in the clinical practice of endodontics is often indicated to correct failures or limitations of conventional endodontic treatment. It is widely accepted that apical resection followed by retrograde placement of a root filling is the treatment of choice in such instances. In the past, the clinician had not placed sufficient importance on the biological assay of the materials employed in endodontics. Dental materials and devices are now being considered more like drugs and therefore have to meet specifications such as biocompatibility. This was formulated in 1972 for the test methodology. Now currently there are three tests: primary generalized toxicity test, screening test, secondary local toxicity screening test and a usage test. Then among the secondary tests, implantation of the material into the subcutaneous tissue of small animals is considered a suitable method for evaluation of the endodontic biocompatibility of the endodontic materials. Retrograde filling materials that are irritating in nature, if injudiciously allowed to come in contact with viable periapical tissue, may then pain associated with inflammation and necrosis may result. Then in addition to biocompatibility, the retrograde filling material should fulfill some other requirements such as non-irritancy, dimensional stability and non-absorbability. Various materials, silver amalgam, gutta-percha, cavite, polycarboxylate, IRM, composite resin, gold foil, glass ionomer and recently the MTA have been introduced over the years for this purpose. A hermetic seal is mandatory for successful endodontic therapy in order to eliminate all portals of entry of exudate, bacteria and the toxins from the root canals into the adjacent periapical tissues. Inadequate hermetic seal of the root canal could be due to many causes such as solubility of the root canal filling material in the periapical exudate, dimensional change, improper manipulation and poor obturation. The commonly employed silver amalgam had certain disadvantages as a retrograde filling material: delayed expansion due to moisture contamination, lack of seal, at least in the initial stages with the prepared root canal surface, large gaps between the amalgam and the prepared root canal walls, biocorrosion and argyria in the surrounding tissues. Then unlike conventional methods of obturation where the material remains within the root canal, a retrograde filling material is immersed in the tissue fluids and remains in contact with the living cells. Since silver amalgam as a retrograde filling material does not fulfill all the criteria, at least in the initial stages, zinc polycarboxylate cement had been suggested as an alternative to amalgam for use in endodontic surgical procedures because of its adhesion to enamel and dentine. Since polycarboxylate has an inherent weakness of dissolving the tissue fluids, and with the increasing use of composite resin in dentistry in the recent years, attempts have been made towards its application in endodontics as a retrograde filling material. Due to paucity of studies on biocompatibility of composite, it was decided to study the tissue response of polycarboxylate cement and compare it with that of chemically activated composite resin as retrograde filling material in the subcutaneous connective tissue of albino rats of Wistar strain. This statement of the problem, it is proposed to study the tissue reaction to two retrograde filling materials, polycarboxylate and composite resin chemically activated. Then rationally to study the tissue reaction to zinc polycarboxylate cement as a retrograde filling material at various observation periods. This was the control group. To study the tissue reaction to chemically cured composite resin at various observation periods, this was the study group. And then to compare the tissue reaction to zinc polycarboxylate cement to that of chemically acted composite resin at various observation periods. A sample of 64 pellets of polycarboxylate cement and composite resin was selected to study the biocompatibilities as retrograde filling materials. These materials were implanted in 16 clinically healthy adult albino rats of Vistar strain weighing 200 to 250. This species was chosen because of maintenance of uniformity in its genetic characteristics. The 16 animals of this study were equally distributed into 4 groups, that is 4 animals in each group to study the tissue reaction at various intervals of observation periods, like after 3 days, 10 days, 20 days and 30 days. This shows the albino rat on the weighing scale. Then the preparation of according to the manufacturer's recommendation, cylindrical pellets of 2 mm diameter and 2 mm length were prepared aseptically from polycarboxylate cement and composite resin. The surgical procedure. An armamentarium was autoclaved and kept ready for implantation for the pellets. The medicaments used were anesthetic ether, betadine, injection paracetamol, injection ampicillin and sulfamycin ointment. Then inhalation ether with the help of a glass beaker containing cotton wool soaked with ether was employed as anesthesia. Then the preparation, the dorsal surface of the rat was shaved from the interscapula to the pelvic region. The area was scrubbed thoroughly with betadine and the animal was transferred to the surgical board. This is showing the scrubbed surgical site. And the implantation of the pellets. A vertical incision of half a centimeter length was made at 4 sites for insertion. Then through each incision, a space of about 2 centimeters was tunneled by blunt dissection in the subcutaneous tissue with a small hemostat. Care was taken to minimize surgical trauma to the surrounding tissues during operative procedure. The prepared pellets of polycarboxylate cement were implanted in the prepared spaces on the right side and the pellets of composite resin were implanted on the left side. These are the pictures. The incisions were sutured with sterile 40 black braided surgical silk suture material. The animal was transferred to a separate cage for post-op recovery and was closely monitored for temperature, pulse and respiratory rate. Then post-operative care was given. Then the healing was normal and uneventful with no complications. The habits, activities and body weight of the animals were closely observed and the sutures were removed on the 7th day. Excision. At the end of the observation period, the animal was sacrificed with an overdose of ether and about 1 centimeter of tissue surrounding the pellets was excised and transferred to the fixing solution buffered for a period of 48 hours. These are the implanted pellets, as you can see. Then the implanted pellet was removed from the tissue and 6 micrometer thickness sections of the tissue were prepared and stained with the HNE for histological study. This is the observation table which showing inflammatory response, then the healing response and the foreign body giant cell response. These are the all over different observation periods. Then these are the histological section showing tissue response to polycarboxylate after 3 days. Shows a mild response. Then this is the histological response, Gen E. Histological showing giant cells. Then the tissue response, the conclusion we came to was the tissue response for zinc polycarboxylate cement was favorable as it showed mild to moderate inflammatory reaction initially, which gradually healed and formed fibrous capsule around the pellets. Healthy condition was restored at the end of the experiment. The tissue response for composite resin showed moderate to severe inflammatory reaction initially, which gradually reduced to mild at the end of the experiment. Presence of eosinophils after 10 days is suggestive of an allergic response of the tissue which subsided at the end of 30 days. Similarly, an early mild foreign body giant cell response was detected at the end of 10 days which subsided at the end of the experiment. Although the inflammatory response for zinc polycarboxylate was favorable, composite resin still showed mild inflammatory response at the end of the experiment. At a glance, the inflammatory response was marginally less for polycarboxylate, with faster and complete healing by fibrous capsule, suggestive of walking off of the inflammatory process. Further, the presence of refractile material in foreign body granulomas, a foreign body cell reaction which was not seen with polycarboxylate, was found in composite resin after 10 days. Thank you.
Dr. Humaira, thank you very much, and I congratulate you for this very nice design study and very rich study. I am editor-in-chief of Clinical Dentistry and Research. I encourage you to submit this paper to us if you're interested in to publish it somewhere, and it honors us because nowadays that kind of animal research studies getting less in endodontics, and this is well designed. So of course, due to peer reviewing, but in first impression, it really worth to be considered. Second thing important, if you are working with the animals, do you have any animals ethic committee permission to cut the animals?
Yeah, we have the Hafkin Research Institute at Bombay. There we are conducting. It's all done with the proper protocol and procedure.
Mm-hmm. I really congratulate you, especially your histopathological sections. Very, very good.
Thank you so much.
Dr. Humaira, that was really good, very good methodology, I would say. But I have a small question for you. You said you're doing a blunt dissection, you're placing these pellets right on the submucomain, it's going to be. Yeah. And did you have any problems in retrieving these pellets?
No, because
it was guarding off and you formed, did you have any induration or did you find any tissue changes around?
Around the pellets, no tissue changes were. Tissue changes were seen only in the histopathological studies.
Quite an interesting way. The design is pretty good, actually.
I'll show you see this.
Right.
Yeah, you can see it here actually more clearly. You can see the implanted pellets. These were the suture after the suture, and after this.
The suture was for your identification that the pellets subcuticular. Okay.
See, this was how it was placed.
Yeah.
With the blunt.
Could I ask you to come and collect the certificate, please?